take a seat on the grey chair there. Alright, Michael, so I've had a look at your electronic client forms and it looks like you're suffering with some shoulder pain, is that right?
Yeah, right shoulder pain.
Right shoulder pain. How long's that been going on for?
I've had it for a couple of years. I'd say 3 to 4 years. But
Yep.
Yeah.
What started it off?
Progressive with training in the gym. So I was doing lots of bench press, and then it just started to more recently get worse.
Yeah, okay, cool. All right, well, the good thing is that shoulders are something that I treat a lot. I actually really love treating shoulders, so you're definitely in the right place to be able to help you. Now, just because it's your first session with me today, is it okay if I go through how today's session will run so that you sort of know what to expect out of today?
Yeah, definitely.
Awesome, cool. All right, so there's 3 main things we want to achieve out of today. So the first one, I'm going to ask you a whole bunch of questions to hear what's going on for you, what your main goals are, and sort of what you want to achieve out of treatment. Yeah, does that sound okay?
Sounds good.
Awesome. Then after that, we'll get stuck into some orthopedic tests. We'll do a series of orthopedic tests to work out exactly what's going on in your shoulder, what structure is causing that shoulder pain. At that point, I'll let you know what the diagnosis is, but also your prognosis, which is how long it actually takes for your shoulder to get better. Yeah? Does that sound pretty good?
Sounds good.
Awesome. So at that point, that's when we get you stuck into a bit of treatment so that you can get a bit of relief today. But the third thing we really want to do at the end of the session is to put together a really detailed treatment plan for you. So the treatment plan that I'll put together for you will cover exactly what you need in terms of treatment frequency and duration. We'll talk a little bit about what the exercise component is going to look like, and also in terms of, you know, how many sessions you're going to need in that window of time as well. Does that make some sense?
Yeah, it makes sense.
Cool. Now you can have a look at the plan. If you like it and you want to get started, we'll book it all in today out at front desk. If you don't want to get started, that's completely up to you. I really like to work with people who follow my advice completely to the letter, because that's what gives me pride in the results that I get. Yeah?
Okay. Sounds
Awesome.
good.
Now it's perfectly normal to have a lot of questions about the treatment plan, so at the end, don't worry, there's plenty of time to ask any questions that you have about the plan, like what the price is, what to do if your schedule doesn't match, all of those sorts of things. So I want you to feel super comfortable answer any of those questions. Yeah?
Okay.
Cool. Awesome. All right, so let's get started into what's made you come to physio now. You've had the pain there for a couple of years. What's made you take the time to book the appointment today?
Just more recently, it's starting to get worse. I feel like I've tried to give it a bit of rest and deload, but it just keeps getting worse. So.
Yeah, okay. So it's not really responding to the rest.
Nah.
Must be frustrating.
Pretty annoying, yeah.
Yeah, totally. And why have you chosen it just specifically to get you back to health?
I've just got a couple of mates from the gym that come here and they've had good results in
Who's
the past. Andrew Davis is one of them.
Yeah.
Michael Hewitt, another big powerlifter. he's had good results here. So.
Yeah. We treat them quite a lot with all of their injuries. It's a crazy sport, the powerlifting.
Yep. Yeah, they're both always injured.
Yeah.
Good blokes though. So.
Hopefully we can keep you out of the injury realm that they are in.
Yeah, that'd be awesome. I'd hate to get all those too.
Yeah. That's all right. We'll organise it. So thinking about today's session, what do you most want to get out of today's session?
For me, it's probably the pain would be nice to solve.
Pain relief.
But I don't really know why it keeps happening. So I want to know why it's happening so I can stop it, because it's just progressive and super annoying.
Yeah. Okay. Cool. Yep. I can definitely do those 2 things. Is there anything else you really want to achieve out of today's session?
No, I don't think so. No, more just that. I really want to know why, because I feel like I know my way around the gym pretty well, but I can't seem to figure this one out.
That's okay. That's my job. I'll help you figure it out.
Perfect.
So thinking long term, so 6-12 months ahead, what do you want to be able to achieve out of physio?
I've got a comp planned actually in 5 months, so I'd like to be able to bench 200 kilos. That's been a goal of mine for ages, and I feel like this has been over the 3-4 years limiting me every single time.
Yeah.
So I'd love to be able to bench that.
Which comp is it?
It's Queensland State titles.
So that's pretty important for you then. That's a big comp.
Yeah.
Yeah, Totally. Okay, so get through the comp. You want to be able to hit your 200 kilos, hopefully win the state titles. That's pretty cool.
Yeah.
Anything else aside from that you want to be able to achieve long term?
Nah, I can't think of anything other than just work. Like it does bug me a bit at work. I'd love to be able to not feel it at work.
Yeah. That's perfectly
even
normal.
Just basic things. So.
Yeah. What do you do for work?
Mechanic.
Okay.
So getting under the car and lifting things, and just every now and then I'll get it on an angle and I can feel it. I'd love to be able to just not feel it at work.
Yeah, totally. Yep. I mean, that seems important to me, but why is it important to you to be able to continue working?
I guess income. We're thinking about having a baby next year.
Yeah.
If I can't work, we don't have income, she won't be at work. I just get a bit nervous about that, I guess.
Yeah. Okay.
Yeah.
That makes it super
Especially with
important
COVID
to me.
and everything like that. So.
Yeah. Totally makes perfect sense. And with your comp, obviously, that'd be pretty cool to win Queensland state titles. Why is that important to you?
I've won it the last couple of years.
Wow. Well done.
Yeah, but I want to take it a little bit further.
Yeah.
So if I don't win that, it's pretty frustrating. You know, so much effort and time put into it.
Yeah.
Yeah.
Totally. Cool. All right. Well, I'm pretty excited to help you achieve all of those goals. They're really, really good goals. Let's switch gears a little bit. So talk to me about how your shoulder is affecting your life right now.
Yeah, more just frustration, I guess. It's starting to really piss me off. Like it's now at the stage where rather than just hurting and bench pressing, I'm feeling it just niggle with random things. So it's a lot more reactive, niggly.
Yeah. What do you think would happen if we weren't able to solve it and that kept going?
Pretty fearful of it. Something snapping or something breaking, becoming worse.
Yep.
And I know I deload every now and then, but I could still train other things. I feel like if I couldn't train at all, I'd be a bit of a nutcase.
Yeah. Yep.
Yeah.
Should we keep it for your mental health?
Yeah, absolutely. Yeah, I struggle to take a week off, let alone. Couldn't imagine 8 weeks off. Yeah.
Okay. Yep. We'll try to avoid that for you.
Perfect.
How does that sound?
Yeah, that sounds good. That's why I came here. They said that you guys like to work, with clients and keep them in the gym still, whereas my GP just keeps saying you need to stop training forever.
Yeah, we hear that a lot. But yeah, we'll be able to give you all the advice around what you need to be doing training wise and
sweet.
when to deload and what muscles to work on around your injury as well. All right, so just to recap a little bit, so you're obviously having your shoulder pain, you've had it for a couple of years, it's getting worse and worse, that's why you've booked in today. Basically, if out of today's session we can give you a bit of pain relief and get down to actually why it's hurting, you'll be pretty happy with today. And then long term, if we're able to get you through your comp, be able to hit your 200 kilos bench and hopefully keep your winning streak happening for the Queensland state titles, you'd be absolutely stoked. And then also on the other side, you want to be able to keep working as a mechanic so that you can have income to support your family, so that you're comfortable going into your first child. That's pretty much
Sums it up
it.
pretty well, yeah. Yep.
Cool. Awesome. So let's talk a little bit more about your shoulder. What sort of things, other than obviously bench press itself, which you've already mentioned, what sort of things aggravate the pain?
Mainly anything that involves coming across. So if I'm reaching over that way for the spanner to grab a nut off the tyre, every single time, like every time I come across, I can feel it.
Yeah.
Even coming up overhead, it gets a bit stiff. So yeah, if I've got the wrench up under the car and trying to unscrew the axle every time, it just gets stuck like that. So they're probably the main things that every time really aggravate it.
Mm-hmm.
Sleeping on it too, I wake up with it pretty sore and achy through the night.
Yeah. Is it actually inhibiting your sleep in any way?
Yeah, I think so. Well, I've never kind of considered it previously until the last kind of month. Now I wake up every night with it. So yeah, I'd say so.
That's probably playing into the frustration and anger a little bit that you mentioned before.
Yeah.
Lack of sleep.
Yeah, probably, yeah.
All right, so easing factors, is there anything you've found actually helps to ease the pain in your shoulder?
Yeah, avoiding the wide grip bench press seems to help. Like if I come in a bit narrower, it seems to feel a bit better. Yeah, the physio cream's nice. It feels nice. Yeah.
That's actually one of my favourite topical
Yeah.
creams.
Oh,
Yeah, that's why we sell it. Yeah.
Yeah, I wasn't sure if it did anything, but Mrs. rubs it on there if it was good.
Yeah. I think anything that helps is worth using. What about things like heat, ice, those sorts of things?
I've tried icing it. I didn't really get too much out of it.
Yeah.
Other than kind of a bit numb.
Yeah.
I haven't tried heat yet though.
Okay.
Yeah.
That's all right. Are you getting any pins and needles, numbness, tingling, anything like that?
A little bit at night.
Yeah.
I wake up with a dead arm every now and then.
Is that because you're sleeping on it?
Yeah, it could be. Yeah,
Yeah.
maybe.
Okay.
But it's definitely more now than it used to be.
Okay. Where are you feeling the numbness?
It'll be, it's not specific with the whole entire arm. Just
The
goes
whole
numb.
arm. Okay.
Yeah.
We'll test that out and make sure it's nothing to be worried about.
Yeah.
Any tingling though?
No, just when it comes back to life.
Yeah. Okay. Makes
Yeah.
sense.
But it is both arms, so it's probably just
It's
me.
both arms.
Yeah, it's probably just me sleeping like a spastic. To be
Yeah.
honest, Mrs. reckons I sleep like that. So
Okay. Yep. That will do
yeah,
it.
she's taking
You actually
pictures.
put your nerves on the stretch when you're in that position.
Yeah, I
So
thought that might be it.
maybe try adjusting that. So arms down and see if it takes away the numbness. And we'll do some assessments today and make sure it's not your neck as well.
Sure.
Are you getting any weakness in through the hand
No.
or down into the arm? You're not dropping items or anything like that?
No.
And any clicking or clunking in your shoulder?
No. Every now and then it might click, but the other one does that too. So
Okay.
I don't think I'm not too worried about that.
Okay, cool. Not a painful click.
Nah, not really. No, just weird. Yeah.
Yeah, okay. Awesome. Now, have you had any unexplained weight loss or loss of appetite?
No, certainly not.
No. Okay. And any dizziness, difficulty breathing, blurred vision,
No.
anything like that?
No.
Excellent. Any scans on your shoulder?
I did actually have an ultrasound
Okay.
about 3 years ago.
Did that show?
It showed mild bursitis,
Okay.
but I've got a mate who's a physio. He hadn't finished uni yet, but he said that. I mean, you guys probably know a lot more than he would, but he said it's probably not really too much of an issue.
Yeah.
He reckons they turn up on most, so I didn't really think much of it and kind of went away, but now it's come back with a vengeance. So.
Okay, cool. And was that when you first initially injured your shoulder?
When I first noticed it, yeah.
Yeah. Okay. And can you tell me around that time 3 years ago when you initially felt it, was there a big incident that happened that made it sore initially, or did it build up over time?
I feel like it may have built up. I did feel it after, I remember a particular bench press session.
Okay.
I did feel it. It was kind of like, I may have strained it. It was like a Velcro sensation.
Okay.
But it didn't really hurt, and I feel like it was kind of progressively getting a bit stiffer and sore, building up to it.
Yeah. Okay.
And then I did nothing for 12 weeks after that, and it just went away.
Yeah. Okay. And then returned
And then it's come back.
just in the last few months.
Yep.
All right, so I just want to ask you about your past medical history. You haven't popped anything on your form, but just to reconfirm, there's no other medical conditions that you have?
No.
Yeah. And are you on any medications at the moment?
No, just popping Nurofen here and there for a headache, but
Yeah.
that's it, yeah.
Okay, cool. Are you trying it for your shoulder as well?
I did do, but I didn't really notice it did much for me.
Make a difference.
No.
We hear that a lot.
Oh, really?
Okay.
Yeah.
So, can I ask, what do you think is stopping you from getting better?
I think I just don't really know what not to do and what to do.
Yeah.
I don't really know. I'll stop using it and then 2 weeks it's back again, so I don't really know how to get around it.
Yeah.
But in powerlifting, I don't, bench press is one of our main things, so I can't really avoid training.
Mm-hmm.
I just don't know why it keeps coming back, so yeah, I guess, no clue.
Yeah, okay, so that makes sense. So these sorts of things are what we call roadblocks. So they're things that kind of get in the way of you fully getting better.
Yeah, okay.
So not knowing what to do is an okay roadblock, because I'm going to help you know what the underlying cause is and what to actually do about it. When you mentioned, you can't avoid training it, that is a semi-roadblock in some ways, because obviously if you're training at a high level, it does potentially put you at risk of injuring things.
Yeah.
But what we're going to do is do our best to sort of get around that by giving you some advice on the exercises that you need to be doing, and helping you with your deloads and making it a bit more specific to your shoulder strength work that you need to be doing.
Okay.
Is there, now that we've talked about roadblocks, is there any other roadblocks you can think of in your life that are going to get in the way of me being able to get you fully better?
No, I don't think so. Yeah, maybe work if that's aggravating it.
Yep.
But, that's another thing I can't really avoid. So. Yeah. No, I can't think of anything else. No.
Yeah. You're just working on cars?
Yeah, I'll do a motorbike, but mainly cars.
Yeah, okay. Yeah, so not super heavy. We should be able to get, if you can bench 200 kilos, we should be able to get you to the point where you can work as a mechanic without aggravating it.
Some heavy motors, but yeah.
I'll keep it in mind, definitely. Okay, so talk to me about your exercise regime at the moment, or your training program. How often are you going to the gym?
I'm in there 5 days a week.
5 days?
Yeah. 2 days I'll train on squats and deadlifts on lower body.
Yep.
And I'll do 3 days of upper body, and 2 of those upper body days are pretty heavy on the pressing stuff.
Yeah.
And that's where I'll feel it.
Are you looking after your own program, or have you got somebody?
Yeah, I have a coach from powerlifting gym.
Yeah. Who's that?
What's it, sorry?
Who's that?
His name's Thomas.
Oh, we look after Thomas's clients
Yeah,
all the time.
He was one of the guys that said, "Come here, you guys are fantastic." So.
Yeah. Okay, that makes perfect sense. So what I'll do along the way is, if there's anything that I come across that needs to be altered in terms of programming, I'll just lay eyes with Thomas, because he's really good at what he does.
Yeah, so it sounds good.
Cool. And working as a mechanic full time?
Yeah.
Yeah. And is there any other sort of hobbies or interests that I need to keep in mind with you?
Nah, not really. Just work, gym, and hanging out with the cats and dogs at home.
Cats and dogs?
Yeah.
And a wife?
And a wife, yep.
Yeah, excellent. Cool. All right. So basically, we found out you've got shoulder pain. Today, what we need to do, get you some pain relief, work out why it's happening, get you through your bench press, get you being able to do your work without pain. Super important to you. We need to work on possibly some roadblocks around your training program, which is cool. Do you think there's anything else at all that we need to know about your situation that we haven't covered just yet?
I don't think so. That sounds like a good wrap up.
Yeah, awesome. All right, so like we were talking about at the start, so we're going to get stuck into some of those orthopedic tests now, okay? Sound good?
Yep.
No questions yet?
No questions, sounds good.
All right, let's get stuck in. All right, take a seat, Michael. I'm just going to take you through all the tests that we just ran then. So when I had you on the bed just then, you know that really tender, thick spot that we found through your right pec?
Yep.
That was essentially your big pec muscle that you used to bench press. It was really thickened and tight, so it was actually restricting your ability to externally rotate your shoulder. So I think what may have happened 3 years ago is you actually probably did a decent tear to your pec, and what's happened is it's scarred over the top of that muscle.
Okay.
The other thing we found is your impingement tests were positive as well, which basically means that the little space in your shoulder here that normally stays open when you do different shoulder movements is actually pinching down, which explains why you probably had some of that mild bursitis on your scan, because when it pinches in there, that's right where the bursa is. So you probably, if you had a scan now, it'd probably be showing a little bit of that too. The other thing that was really tender when I was palpating through was your bicep tendon. So, you know, like your normal bicep where you do a bicep curl. Up through the tendon there was really sore as well. So I wouldn't be surprised if you've got some tendinopathy happening through there. So the really fancy term for it is called subacromial impingement with a biceps tendinopathy from your previous pec strain that you had.
Oh yeah, makes sense.
Yeah, cool. So basically for you, because it's been going on for so long and that pec tear is healed over and quite scarred and thick, and because your range of motion is quite limited in rotation, it's actually going to take us probably a good 3 to 6 months to get fully on top of your range of motion. Now, that doesn't mean that you're going to be as sore as what you are right now, but it's going to take that long to realistically work fully on getting your range of motion back to where it should be for your level, but also all of the strength and rehab work that you need to do around it's going to take time. You would know that, you don't go from benching 50 kilos to 200 kilos overnight.
No, I was expecting it to take a bit of effort,
Yeah. So we'll go into more detail about exactly what the treatment plan will look like for at least the next 3 months at the end of the session, but for now we'll get you stuck into treatment so we can at least get some movement happening for you. Cool?
Sounds good, yep.
Excellent. Questions yet?
No, just keen to get stuck into it, yeah.
Awesome. Let's get on the table. Okay, Michael, do you feel okay after all that treatment?
Yeah, it feels good, nice and loose, and
Good.
yeah, a little bit tidier.
Yep, not too sore where the needles went in?
Oh, a bit achy, but nah, feels alright.
Cool. Awesome. So do you remember at the start of the session when I said I'd put together a treatment plan for you?
Yep.
Do you want to hear it?
Yes, please.
Yeah, cool. All right, so this is your treatment plan here. So basically it's split up into 3 separate phases. So the first phase through here is called symptom reduction phase. So symptom reduction phase is, as it sounds, all we're trying to aim to do in this phase is reduce your symptoms down. So for you, it's your shoulder pain, the pain that you're getting when you're lifting above your head, and some of the pain that you're getting when you're actually bench pressing.
Mm-hmm.
Yeah. This is the most intense phase in terms of your actual physio hands-on treatment. So I need to see you again this week, twice next week, and I'm going to take you weekly out to the 6-week mark. The reason I want to see you so many times is there's heaps and heaps of hands-on work we need to do to the pec, the bicep, and all the surrounding muscles to be able to get it all moving properly. Like I said, it's been there for a really long time, so it's actually going to take a bit of physical effort on my part to get your shoulder to the point where it can move properly, yeah?
Yeah.
Cool. Now, I fully expect you to be in a small amount of pain all the way to the end of this phase. So at about the week 6 mark is when I'd be expecting you to start coming in saying, actually, it feels really good, it's not too sore now. But if you're still in pain sort of in the middle bits here, don't worry, it should be starting to drop down, but I do actually expect it to take that 6 weeks to fully settle, yeah?
Okay.
Cool. Now, restorative phase is the second phase. So this is where we aim to restore normal function again. So for you, what this is going to look like is trying to actually get your rotation to a level that's normal for a powerlifter. Getting your bench press to a point that's normal for a powerlifter as well. And this is where we tend to focus on a lot of the rehab side of the exercises. Yeah, so you're going from sort of mobility work to transitioning into more of the strength work. This is probably where I'll use Thomas the most.
Oh, yeah.
Yeah, okay. So this phase, we drop out the treatments to fortnightly. The reason for that is your shoulders should be moving a little bit better. You're still going to need your hands on in those fortnightly sessions, but not as intensely in the first phase. We're really trying to work on all of the strength side of things in there.
Okay.
Cool. Now for you, because you're aiming for a 200 kilo bench, we may actually continue that phase on a little longer, but we don't want to try and predict 3 months past that. So what we'll do at this last session is do a reassessment and just see how you're tracking. If there's still like heaps of strength work that you're needing to be doing and still some hands-on, then we'll continue it on. But if you're tracking pretty good, then we'll move on to consolidation phase. Consolidation phase is the third, probably the most important phase for clients because it's the most commonly missed phase from most physio treatments. All we're trying to do in consolidation phase is basically make sure the problem doesn't come back again for you. because it's commonly missed, what tends to happen is people feel really good, they work on it, and then they miss this phase, and then they end up back at square one again, and we've got to redo the whole treatment plan again, which we don't want that for you. We want to make sure that we work on it once and properly. Yeah. So in this phase, what we do is we tend to see you either 4 or 6 weeks apart. And what we're doing at those sessions is basically reassessing your shoulder, making sure none of the structures that we found today that were really tight and sore are starting to get worse again, and also help guiding you through all the way up to your comp as well for you. All right, so that'll go for the rest of the time period that we talked about before. Yeah, does that all sort of make sense, those 3 phases?
Yeah, it does.
Yeah, cool. All right, do you have any questions about them, about the sessions?
No, that makes sense.
Cool. Are you comfortable to book all these ones here on the slip-in today?
Yeah, I'll have to check the roster for work, but yeah, more than happy to get those sessions in.
Yeah, totally. Yeah, with your work roster, so the clinic is open from 7:30 to 8 p.m. at night, so it's pretty...
Okay, you see that late?
Yeah.
Oh, beauty.
Yep.
Right.
Yeah.
No excuses then.
No excuses, but the late slots are probably the ones that book out the quickest.
Right, okay.
So we'll definitely aim to get those in today. If you have any changes in schedules, things like that, just let us know so that we can adjust the treatment plan. It's really important that you stick to the frequency of sessions. It doesn't so much matter whether it's Monday or Friday. As long as we're getting the frequency correct, then you should be okay. So just let us know. Do you have any other questions in relation to anything at all we've discussed today?
No.
Even little ones? There's no silly questions.
No, I don't think so, no.
Cool. Excellent. All right, so we'll go out in a second and get all of these booked in with the girls out the front. The most important thing is that you're sticking to the frequency of session. Let us know. You may be a little bit sore after today's session, and that's perfectly normal. Just let me know next session if it was quite intense, because we can adjust the treatment if we need to. If your pain gets better, that's really, really cool, but we've got a lot to work on, so make sure you do still turn up to your treatment sessions that you're going to get booked in.
Yeah.
If things don't change too much, that's also okay. We've got this full 6 weeks to really drop the pain down.
Yeah, no, it's been here a while. I expect it'll need a beating.
Yeah, it will a little bit. Yeah, so we'll check in every session and see whether you're on track. Cool. And then in terms of the exercises that I want you to do, they'll come to your email.
Okay.
So sometimes, depending on your mailbox settings, it can go to your junk. So make sure you go in there and check it and start those exercises from tomorrow. All right?
Sounds good.
Cool. All right, let's go out to front desk if there's no other questions.
No.
Awesome. All right, it was nice to meet you. Let's go out and see the girls.
It does.
Okay, Dale.
Hey Anita, how you going?
Good. So this is Michael's treatment plan. I am super excited because we're actually going to help him get through the state titles for powerlifting. He's aiming for a 200 kilo bench.
Oh my gosh.
I know, it's insane. Cool, so this is his treatment plan, so pretty straightforward. Just let me know if you can't find the slots and I'll find a solution for Michael.
Great. Fantastic.
Excellent.
All right, Michael, let's get those in for you. How exciting. You're in great hands with Anika.
Perfect. Sounds good.
Thanks, Mike. I'll see you next week.
Awesome. Thanks.